At some point, usually right at the start of treatment, the topic of catheters will come up. Maybe even before the operation or maybe afterwards. There are different manufacturers, types, and names, and I'd like to take a look at them together with you. So, you probably know those little needles and tubes you get in your arm or hand, for example, when they draw blood, right? Yes. So that's called a peripheral venous catheter. Tough word, right? It means that using a short needle, a small tube is inserted into a vein, usually in the arm or hand, and then the needle is removed right away. But the tube stays in, for example, for further blood draws or infusions. And because these small blood vessels are sensitive, the tube usually has to be removed again after just a few days. When treating cancer, medications and fluids often need to be administered repeatedly over a longer period of time. That's why a different type of catheter is needed, a central venous catheter, or CVC for short. The difference, this catheter is placed in a large blood vessel, and it's not just inserted a short distance, but almost all the way to the right atrium of the heart. A central venous catheter is needed when you want to deliver a large amount of fluid into the body in a very short time. The small vein simply can't handle that. You also need it, for example, when chemotherapy is to be administered, because that could irritate the vessels. And maybe you know this too. If you get pricked several times in a row for blood draws or an infusion, at some point there just isn't a suitable vessel left that can be used. Then all of them are just overused. By the way, for short chemotherapy treatments and older children, it may be that you don't need a central venous catheter at all. The doctors will weigh the benefits and risks for you or your child, and will discuss this with you. There are several types of central venous catheters. One type remains in the body for a maximum of 2 weeks. Not longer, because otherwise the risk of infection is too high. This catheter is needed around the time of the operation, or if you or your child need to be treated in the intensive care unit after the operation. The end of the tube often sticks out of the groin in babies, and in older children, for example, it comes out at the neck. Another type can remain in the body for 2 years or even longer until it is no longer needed. This catheter is used, for example, when a longer course of chemotherapy is planned, or if you or your child regularly need large amounts of fluids. It is also used, for example, for regular blood draws or for administering medications to treat side effects. With the permanent indwelling catheter, which can stay in the body for up to 2 years, there are again 2 types. On the one hand, there is the type where the end of the tube sticks out of the body. Usually it comes out of the chest, so about here. There are many different manufacturers that make this type of catheter, and one of them is Hickman, a name which you may have heard from some insiders. Another example is the Broviac catheter. On the other hand, there are central venous catheters, where the end lies under the skin. The tube ends under the skin with a port. This is a capsule, which you can also feel, and it's about the size of a coin. When a catheter is inserted, it is always done under anesthesia in children. So your child or you as a teenager won't feel anything at all when the tube is being inserted to the right position. There will probably be some discomfort when your child or you wake up, but you'll get pain medication right away. And after a few days, you get used to it, that there's now a tube in your body and you hardly notice it anymore. Speaking of getting used to things, the catheter that ends under the skin with the port is the one you notice the least. It doesn't bother you in everyday life. But this port catheter has to be punctured with a needle every time it needs to be used. However, that's just a quick prick. The catheter, where the end of the tube comes out of the body, like the Hickman or Broviac, can be used directly every time. However, it does require a bit more care and also carries a risk of infection. So nothing should get dirty or wet, neither the tube nor the dressing. For example, when showering, you have to use a waterproof dressing. And the spot where the catheter exits the skin must be bandaged regularly and very carefully to be sure that no germs can settle there. But the nurse at the ward will take the time it takes to show you all of this thoroughly, ensuring you understand every step. In the morning and in the evening, you should always check to make sure that the cap is securely on and the clamp is completely closed, as this is very important for proper operation. Like this? Yes. And that the dressing is secure. And when playing and roughhousing, you can't just throw yourself onto your stomach or slide down the slide on your belly. Having a catheter won't always be easy for you or your child, right? But it really does make the treatment much, much easier. But if something ever feels really wrong, slips out or even hurts, remember to let someone at the clinic know right away. Swelling, redness, pain, or fever can be signs of an infection that needs to be treated immediately. But your care team will also give you detailed instructions on how to take care of the catheter and what warning signs to watch out for.